no. I've reacted to scenes from all types of medical shows, but rather than take a look at medical dramas, I thought we could have a good laugh and look at some medical scenes from SNL that have gone viral over the years. For those of you who aren't completely familiar with Saturday Night Live, the show's been a staple for 4 decades, featuring an ensemble cast to perform comedic sketches, satirical, news, and digital shorts. But before we get into it, my name is Dr. Jordan Wagner. I'm an ER doc that deals with every medical situation that you can think of. Gunshot wounds, COVID, broken hips, firework mishaps. I created this channel to answer the medical questions that I get asked from people every single day. If you find this video helpful, please smack the subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, ready to watch some funny medical clips? Let's react to Saturday Night Live. Oh my gosh,
training.
I love it.
It's actually an exciting day because I'm going to be teaching you the new guidelines for CPR.
So before we see it, so CPR always changing guidelines because the new evidence is emerging every few years. So that's fantastic.
For over 50 years, the American Heart Association has recommended mouth-to-mouth. But now
the American Heart Association is the standard.
Only CPR is the new life-saving standard.
So this was a change a few years ago. Hands-only CPR, no mouth-to-mouth.
So let's just jump right in. Let's take a look at the proper way to perform the new technique. Now, what the AHA recommends is to simply push down on the victim's chest hard and fast. So I'm just gonna put one hand on top of the other like this, and I'm just gonna start compressing. Compress harder, guys. You sure?
Yeah, I'm good.
Okay.
All right, the bed is already too high to do CPR. You need to be a little bit lower.
About 100 compressions per minute.
Thomas,
Okay.
you're not gonna hurt.
Oh gosh. The CPR needs to go middle of the chest. The easiest way to look at it is between the nipples, basically, of your chest. And both hands together, you need to go down about 1 inch to 1.5 inches and compress down at about 100 times a minute. There is a song that you can do in your head, which is a positive song, even though it's a scary situation, called Staying Alive. So you can do CPR to staying alive, staying alive, staying alive. That's the beat of doing compressions in that emergent situation. When everybody's freaking out, if you can remember that, just do the CPR and call 911 or somebody get a defibrillator, okay?
All right, I'm gonna do some very firm compressions here, like so.
Oh, no. Okay, I don't mean to be laughing, but this is... Okay, you can't do that in real life. It doesn't happen that way. So you're protected by your sternum, your rib cage during CPR. You cannot go that deep. Now, this is kind of gross and kind of scary, but during CPR, there is a high likelihood and chance that you're actually going to break the individual that you're doing CPR on their ribs because of the compression. The ribs are bones and they're not made to kind of bend in, because what you're trying to do with CPR is you're trying to beat the person's heart for them. You're trying to compress the heart to allow to squeeze the blood out and allow it to fill again. You're doing compressions to be able to pump blood to the whole body so the body is oxygenated, especially the brain and the heart and the lungs. So you're doing your best to save the person's life. If you don't do proper CPR and good compressions, the patient has a higher likelihood of chance of dying if you don't do anything. All right, let's check out the next video.
You know, when I hit 50,
Oh,
my
nice.
body went
The
through
Rock,
a big
sweet.
change, and not for the better. Severe erectile dysfunction shattered my confidence, set me into a depression, and
This
almost ruined
happens.
my marriage. And believe me,
Erectile dysfunction is a real thing. It happens, and that's why there's medications out there. There's lots of them, Viagra, Cialis. There's lots of different choices to help increase blood flow for the male member. All right, let's keep going.
I tried everything. But then a friend told me about Zentrex.
Zentrex.
So I tried it. And it worked.
Zentrex is the strongest male enhancement drug on the
Okay.
market. It increases blood flow, boosts testosterone, and ends erectile
Okay.
dysfunction
All right.
instantly.
So I asked my doctor
Like how you
about
guys did
Zentrex,
this.
and he said, Zentrex?
That's my reaction. What's Zentrex?
Rhino horn, ammonium
Oh my gosh.
hydroxide? That's what's in meth, right?
Oh my gosh. So Zentrex, whatever it is, multiple different illegal substances, different substances that increase blood flow, increase heart rate, definitely not good for your heart. Just like methamphetamines are not good for your heart. It'll give you energy, but it's probably not the best thing to do. So any prescription that you're getting should be prescribed by a physician, a doctor, nurse practitioner, a PA. That way you know it's approved, it's been tested, and hopefully it doesn't injure your heart or the other member, okay? Let's check out the next video. Chantix, helping to stop smoking. All right.
I had to quit smoking.
Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people have had changes in behavior, such as hostility, depressed mood, and homicidal thoughts and actions while taking Chantix.
Chantix is a medication to get you off of smoking, but it's also on the same realm of an antidepressant medications, which all antidepressant medications increase your risk of suicide when you first start taking it. So a doctor will explain all this to you, but there have been reactions like this in the past. So every warning that you ever see on a medication is every single event that has ever happened from even just one person taking this medication. They have to divulge that information to you. So these things have happened, so it's something to be aware of. So you're trading one problem for the next. So you always have to weigh the risk and the benefit of what you end up taking or ingesting into your body.
Overwhelming desire to kill the person you love most? Call your doctor right away.
This is not a normal warning, but I wouldn't want to take something that's going to make me want to kill somebody.
As they may drastically increase the desire to kill.
Caffeine is a drug, okay? You need to be aware of that.
Notice symptoms such as rashes,
What?
fever, droopy lip, jazz hands, Robert De Niro face, incredible Hulk strength.
I've seen patients that get every single side effect, even though when you start explaining the different symptoms, all of a sudden they start saying, yes, I have that and that and that. So it's, it's very interesting. I just love the droopy face and the Robert De Niro hands.
Common side effect of Chantix is mild nausea, as well as waking nightmares, where patients violently paw at the person sitting next to them. So use caution.
And my cat does that component. I get violent paws in the middle of the night. Oh my gosh, she's not on Chantix.
Waking nightmares. Kill him, kill your husband.
Oh
now.
my gosh, oh my gosh.
Chantix, just keep smoking.
Oh my gosh. Okay, all right. So medications to try to get you off smoking. People have been successful using these medications to stop smoking. Other things people have done, they've vaped. Years ago, we had the problem with the chemicals that were in the vape solutions that actually hurt people's lungs. We now have vaping that's a little bit better, but again, smoking anything is not good. So do whatever you can to get off smoking, because we know that it's healthier living, and you'll feel better and you will live potentially longer if you stop smoking. All right, let's check out the next video.
I bet there are people
it's
in
the
this
Oz show.
who are having the same problem as you.
I like the purple gloves.
Years ago, I broke my tailbone skiing.
Ooh, there's a lot of nerves in your tailbone.
Tailbone injuries are painful.
Go ahead, Kenny.
All right, well, I noticed
Can't
I've
even
had
sit down.
problems with my my evacuation.
Yeah.
With your bowel movements. I got something I want to show you. Come over here.
Us doctors, we always turn everything into like medical terms that are like serious about it. You can't just say poops, evacuations. Or number 2.
Come over here.
Oh my gosh, oh my gosh. Oh my gosh. Oh no. Oh my gosh.
Okay, I'm gonna put this
Okay.
on. Okay, right here. Okay? Okay, I want you to walk through here. I'm gonna show you something. I want to show the audience something. Now walk through the edge. Walk through. Now watch how the poop goes through the rectum, right through the day, right into his box. Just like that.
So I will have to say, as a doctor, and many of my colleagues were huge proponents of a healthy colon and pooping. You need to be pooping often, otherwise you get into issues. But the problem is, when somebody has a tailbone injury, coccyx injury, it hurts, and could potentially have movement against that broken bone, and it's hard to go to the bathroom. So you need to make sure, this is really weird, that your stools are soft, that your poop are soft and easy to flow out. There are medications that you can take. Talk to your doctor if you're having any issues. Poor guy totally got embarrassed in public on TV, and he became his own poop. So it was actually a really funny show. All right, let's check out the last clip.
So how's she been? Is she adjusting okay?
She's getting along just fine.
I love that we talk about people when they're there
friends yet,
not
Jay?
interacting with them. Oh my
She's
gosh.
making plenty of friends.
Oh my goodness. They make movies about this
Seems
stuff.
a little out of it. Is she okay?
Oh, she's fine. She's a little grumpy because she just got her penicillin shot. She doesn't exactly love needles.
Penicillin? What's wrong?
Just a little gonorrhea. Well, I'll leave you.
What?
Gonorrhea?
Oh my gosh. True fact. There's actually increased numbers of nursing home patients that actually spread gonorrhea and chlamydia. No joke. And this is because the population thinks just because they won't make babies that they can have unprotected sex. And in this population of elderly people, you can still have intercourse. This is actually realistic. And penicillin is one of the main treatments for gonorrhea. Typically, we use something called ceftriaxone, which is in a similar family as penicillin. But let's take a look at the rest of the video. These are the patients even quiet.
It's very treatable. It should be cleared up in a week or so.
Oh my gosh.
How did this happen?
Oh,
We
don't
think
ask how.
She's 91 years old.
91-year-old people can have sex. Good for her.
Mrs. Connor, your grandmother may be 91, but she still has a very active sex life.
A lot of us don't want to believe that our parents had sex to make us, that they continue to have sex, and that elderly people and our grandparents are still having intercourse. So it's a fact of life, it's reality, and we definitely treat these with antibiotics when we come across them. That's really funny and realistic. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episode in the comments below. And if you want to see me react to video games, check me out on the Experts React series on Gamology right over here. And as always, make sure you subscribe if you want to see more videos like this one. Thank you so much for watching and stay healthy, my friends.